Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Welcome back, everybody. Today we have Karen and Amy Ray and Karen Callagy. These are our OGs at our Boise clinic. We used to all work together at the Boise clinic, and we have so many amazing memories. That's not what this podcast episode is about, as much as I wish we could
so much fun.
Giggle for 45 minutes and share our past memories at the OG Boise clinic. But today we're here to talk about LDI. So very quickly, Karen Callagy is a board-certified physician assistant specializing in autoimmune diseases, thyroid diseases, and gut health. She studied at Penn State University and then pursued her master's in PA at Arizona School of Health Sciences. She practiced family medicine until 2014, where she discovered functional medicine. She has her IFM certification and has been with Functional Medicine of Idaho for over 7 years. Amy Ray is a board-certified nurse practitioner with over 20 years of experience in healthcare. She specializes in autoimmune diseases, gut health, and hormone balancing, providing personalized care to help her patients achieve optimal wellness. She studied at UC Davis and earned her master's degree from the MGH Institute of Health Professions. She has been part of Functional Medicine of Idaho for over 7 years. Those dates aren't accurate. You've been with FMI for longer.
Well, you purchased it
because I've no longer. Oh, that's true.
But okay. I worked for Gail. I've been 10 years. I've been in the office.
I was going to say you were there. You were there before me. Okay, welcome to the podcast. We're
Thanks for having us.
Okay, so we have to start with. So I mentioned LDI as the topic of our podcast this evening, but we have to break that down. Low dose immunotherapy. What is that?
So LDI is a tool we use to create immunological tolerance. Mm-hmm. So what does that mean? Means we're trying to help one's immune system stop overreacting to triggers. And those triggers could be pollens, they could be food, it could be viruses, bacteria in our gut, so internal antigens or external antigens, such as what we call just regular allergies.
And I probably should have started, you two have a specialty certification in LDI. This isn't just something that anybody and everybody as a healthcare practitioner could do.
We've both gone
You guys were trained.
Yes, we've been trained with Ty Vincent. He's the one who started LDI. And I've done a couple conferences with him.
Cool. Okay. So. And you guys are offering this. I know we'll probably get to this, but you're offering this out of the Boise clinic now.
Yes.
You guys are doing this. Awesome.
Yep.
Did you have anything to add to LDI? And
no, that it was just, it started kind of derived from something called LDA, which is low dose allergen therapy. Okay. And it's been around since the 60s. And then Dr. Vincent kind of coined the phrase LDI, low dose immunotherapy, which is what we do in 2014. So he just kind of started experimenting with it and found that
it worked.
It worked. Yeah.
So how does this differ from just regular allergy treatment or therapies that you would go receive at an allergist office, for instance?
So allergen immunotherapy or allergy shots really kind of build on each other, and you're stuck doing those for multiple years, generally once a week or twice a week for 1 to even 5 years, I believe. And the results it just depends, right? They're not all positive response. Sometimes it works temporarily and then the allergies come back. So LDI is different because what we're striving to find is an effective or core dose that mitigates your symptoms for up to 6 or 7 weeks. And they don't build, it's not a cumulative effect. The dose we choose, it'll either work or it won't. So it's trial and error to determine what's working. And we do that based on their symptoms. Okay. And it's different than an antihistamine, obviously, because you're not taking a pill every day to control your symptoms. It's not working on the level of the histamine. It's working on the level of our immune system, our immune cells, our T cells.
So just completely different mechanism of action on how we're trying to attack that response, that allergen hyper response in the body.
It is similar to, it's not exactly, but it's similar to homeopathy in that really it's LDI is sending a signal to your immune system and basically teaching it not to overreact to things in your environment.
Okay, but it's not actually lowering immune function.
I think there's not suppress the immune system.
I think there's a myth out there that it just lowers immune function like biologics do for autoimmune disease.
That's why it's so great.
Yeah, because it does do that.
It doesn't suppress your immune system. It's comprised of sterile water and proteins of antigens. That is it. There's nothing else in it.
Yeah, so it's really almost what's the word for it? Kind of an energy level to it is how it's been described. So
I love that.
And like Dr. Dr. Vincent kind of says that our immune system has like 4 legs to it, basically. So, failure of external defenses gives you infection. Failure of internal defenses kind of gives you cancer. Failure of external tolerances is allergies, and failure of internal tolerances is autoimmune issues. And so LDI does not affect the defense part of our immune system at all. It only is working towards teaching the immune system tolerance. And so it's really cool that it just doesn't have that side effect of decreasing the immune system at all.
Which makes it incredibly safe for newborns,
pretty
pregnant women, anybody. Anybody can do LDI.
Yeah. So it really goes. So how would you answer the question how it totally fits within our approach of root cause medicine?
Yeah.
It does, in that basically it's trying to kind of come up with a way for you to not have to eliminate things out of your, avoid things like,
certain foods
or things in the environment.
Or even other allergens that you might need to avoid.
And that it is, again, kind of working on that immune system to go back to a normal state of tolerance. I always think of it or tell patients, like, you and I can be outside and the pollen is crazy and I can be totally fine, but your immune system is thinking that it's under attack.
Totally.
And so LDI is kind of bringing
saying, hey, don't don't be on fire. Just calm down.
Yeah.
Okay.
Yeah.
It's changed a little bit how we view internal infections. When you talk about root cause, generally in functional medicine, what we're doing is let's order stool testing, comprehensive stool analysis, or toxin testing, food sensitivity testing. We don't have to do that.
Yeah.
We are doing this based on symptoms, known symptoms that correlate with certain problems. And then we're choosing an LDI to eradicate the symptom.
So who's like who's the best candidate for this type of treatment?
Everybody.
Okay. Everybody's struggling with the reactivity to something in their environment.
Yes. So whether that's an autoimmune issue or an inflammatory response or an allergic response.
But don't you have to know what your body's reacting to benefit from it?
To a certain degree.
To a degree, right? So let's give you an example.
Yeah.
Joint pain.
Okay.
How many things cause joint pain? Well, we've got Lyme, we've got yeast, we've got food, we've got hormones or lack of, gluten, all of these things. So when someone comes to us with joint pain, we're trying to decipher, and they're a big piece to this puzzle, right? They might say, oh, well, when I eat this, I get this. Yeah. Or this time of the month, right before my menstrual cycle, I get joint pain. And so they're helping us do this detective
investigation
work to figure out where to start. And sometimes you go through a whole 4 or 5 food LDI and that wasn't it. That didn't do it. So we move to the next one. We try yeast or we try hormone.
So there is a bit of because you have to find the right antigen and the right dose. So it's definitely not sometimes I've hit the nail on the head right away and it's like, all right, they feel amazing, and sometimes it can take quite a while of digging, and we go through history and what might have started, what was going on when your symptoms started. And that's a way for us to kind of start.
Well, you guys are unique because you're trained. You're such brilliant functional medicine providers. So you're working on root cause, but also can help alleviate the symptoms pretty quickly if you have a pretty good target regarding LDI treatment. So that's pretty cool.
Well, and for years we were knowing that this was such a great modality, but weren't doing it. And we were referring hundreds of people.
Yeah.
And so one of the local providers who I was seeing as well, he just kept saying, Karen, go
get trained.
Go get trained.
Yeah.
So I'm grateful that.
And you guys are thankful you did because you felt it. Yeah. It's very beneficial.
So beneficial. There's a subset of the population for whatever reason that are non-responders and it doesn't work for them. We don't know why.
We don't know why.
Yeah.
Maybe 20%, I think, is what Dr. Vincent has.
Oh, that's higher than I would think. 1 in 5.
But it's also important to have a good optimal vitamin D level. He recommends at least 80.
Oh, wow.
Which some people say you shouldn't get too high. It depends on who you're speaking with.
Right.
So I always tell my patients, let's make sure before you take the first dose, if your D is
you're
20,
not at 30.
Let's work on that for a month before we move on.
So so this kind of segues into this, or actually it relates a lot to what we were talking about. When do you decide to intervene with LDI as opposed to bioidentical HRT, gut repair protocols, detoxification protocols,
it doesn't
supplements?
Take the place. I would say, especially with HRT, we know so many pros for doing that for perimenopausal, postmenopausal women. Specifically. So if that's necessary, this does not take the place of HRT. It doesn't take the place of opening up the liver pathways and doing detox, things like that. It doesn't take the place. It's an adjunct. And sometimes it's enough to get people feeling a little bit better, especially if it's food reactions, and we can calm down their immune system a little bit and their inflammation to where they're more motivated to make all the lifestyle modifications.
Isn't that always what we're trying to do?
That are
if I could just get you sleeping.
Yes.
Yeah.
Then you'd be motivated to make all the other changes that are hard for people to make.
Doesn't take the place of those things.
So gut health is still super important and everything like that. Like we don't want to just be like, eat whatever you want and take LDI. It
doesn't counteract sugar, y'all.
Yeah. Totally.
Yeah.
Or sleeping 4 hours a night.
No.
Yeah. Or stressing your body out to the hilt all the time.
Exactly.
Yeah.
So what does a session look like? Is it expensive? Is it time? Is it a time constraint? What does this look like?
$40 per LDI. So it's very inexpensive.
Yeah. Okay.
And it starts with a 45-minute consult and we just, get a background history, determine exactly what symptoms you're trying to combat, what's going on. Sometimes what they come to us for isn't even what we initially end up treating them for.
Oh, I bet.
Because then we open this box. We're like, we probably should work on this first and then we'll get to this. And so
sometimes I pick like, hey, what's the easiest thing or what's the thing that's bothering you the most?
Start there.
And start there. When people are super inflamed and they've felt like they've tried everything and they're still just not getting anywhere, I'm like, all right, let's get a win, like let's work on, a food sensitivity or something like that, or your allergies are terrible and this time of year, like let's get you feeling better there. And then we can start working on other inflammatory responses. But super easy. It literally is a sterile antigen that is diluted in water and you stick it underneath your tongue and you hold it there for about 30 seconds.
So it's oral.
Yeah.
And how many treatments until we see?
It only takes one if you get the right dose.
If you hit it, okay.
It's not a cumulative buildup. It's literally if we choose, again, trial and error, we choose the right dose right off the bat. That's it. That's their core dose. It works. And they will message me maybe in 4 to 5 weeks saying, oh, my symptoms are coming back. I need another dose.
You redose.
Yeah. We just draw it up and leave it up front and they pick it up. Once you know that core dose, they don't need appointments all the time.
Cool.
Yeah. But typically, once we find the right dose, it should last about 6 to 7 weeks.
Okay.
Not always.
But not always. Sometimes we can keep tweaking and stuff, and they're just like, hey, it's only lasting 4 to 5 weeks. And we say, okay, well, then that's going to be what you're going to end up doing.
Okay.
Is that 4 to 5 weeks. But it can be immediate or it can be several months. Like I've had some people who are like, joint pain went away immediately, and others I've been working for quite a while and we're still trying to figure it out and maybe go to a different antigen.
A different patient.
Interesting.
Yeah.
Okay. I have 2 questions. Most common requests you have, right? People wanting LDI. What's the most common issues you see? And then what are you seeing that responds best to it?
I would say allergies, environmental allergies, food issues.
And food issues.
Food intolerances.
Yeah.
Those IgG food intolerances that people can't figure out.
But I've had pretty good responses with skin issues and things like that.
I was going to say from a dermatological standpoint,
Huge.
2,800 types of erythematous red rashes that we see.
Well, how about plaque psoriasis?
Yeah.
So we
use autoimmune.
We use a skin fungal flora, right? So it's a fungal etiology. And so we start with, there's only 4 to 5 different, you find the effective dose very quickly with that one because there's only 5 doses to choose from.
And it works well.
Yeah. I had one patient, she was in her 40s and she's had psoriasis since she was 14 and it didn't last long enough. So we're still kind of tweaking the dose right now, but she called back and was like, I have never had any decrease in my symptoms since I was 14 years old. And she's like, a day later after she took the dose.
Within 24 hours.
Within 24 hours, her scalp started to decrease inflammation.
And how often is she needed to redose?
Like I said, on this one, we're still kind of working on the dose. It lasted about a week. And so we're like, okay, well, we need to kind of tweak that, improve that, modify that. So we're still working on that. But she was just super excited to get that initial movement.
There's a
in her
lot of buy-in
symptoms.
when you get results that quickly.
Oh, especially when
it doesn't
it's an
always happen that
exterior
way.
inflammatory
Oh,
rash.
Yeah.
Okay, so sorry, you answered the most common type of issues that are coming to you, but what about what you're seeing the most beneficial results with? Same thing though?
Those are the easiest for
easiest
sure.
to treat. Okay.
Because it's, we have one that's specifically an environmental allergy, one that's specifically for Boise that's been working fantastic.
Okay.
With kind of the spring allergies and stuff like that.
Well, and you think about with allergies, environmental allergies, I mean, the risk benefit ratio there, right? You're getting them off of the steroids and the claritins and the mast cell stabilizers that have a lot of side effects.
Long term. Mm-hmm.
Like that's huge.
Yeah.
Yeah. And
So
then
cool.
food.
Yeah,
like
sorry, I
I
interrupted
had
you.
somebody who itching, like severe itching with a lot of high histamine foods. And she's just thrilled that she can pretty much eat anything that she wants now and doesn't have any itching and isn't having to take her antihistamines every day and stuff like that. But autoimmune issues, definitely a little harder, but I've seen some great response with that as well.
Promising.
Yeah.
Now, autoimmune disease, I'm thinking more of the silent autoimmune diseases we deal with. So not like the RA that's the inflammatory.
Treat RA.
Well, right. But I'm thinking like more like Hashimoto's or some of those issues.
Yeah.
But you do.
Mm-hmm.
And you see the improvement to fatigue and brain fog and the thyroid.
Yes.
Yeah.
So with Hashimoto's,
okay.
It's the only one that we actually do testing, right? Because sometimes they don't have symptoms yet, but they have antibodies in maybe 100 or 200 or 600, but they might not be super symptomatic.
Right.
So we have them take a dose and then we have them test their antibodies 2 weeks later.
You think it can turn around that quickly?
That's how quick.
Yeah.
Yeah.
It can.
Yeah.
Right? Yeah.
Yeah.
Oh, that's
pretty
amazing.
So we have patients report back within a week for most of the antigens because if you're going to get a response, it's going to happen within that first week. Pretty quickly. And we're looking for a pretty significant response.
Right.
And so there's a few collagen, the Hashimoto's, that's and then some skin issues like alopecia, that it takes a little while to get like hair growth back.
Yeah, clinical results.
Yeah. So it takes more like a couple weeks on those.
Oh, cool.
I've had really good success with the hormone LDI for PMS, PMDD, and menstrual migraines. So it's not changing your hormone levels. It's changing the way your body responds. Some women don't respond well to their own hormones and the fluctuations, right? So
yeah, for sure.
That's a huge win. I do that dosed every 4 weeks though. For them.
To keep them steady Eddie.
Yeah, that's life-changing.
Okay. Yeah, no, I could see that. That's amazing. So you don't see any reactions. You don't see any reactions to these antigens.
You can have a flare.
Sometimes.
A flare of your initial root cause issue. Okay.
So that's the only kind of quote, side effect is if we start an antigen at too high of a dose and people will have a flare. But a flare is like, hey, this is the worst I've ever felt, or this is what it felt like when I first started, with this autoimmune issue or whatever. And it's usually short-lived, usually a couple weeks.
I flared myself with an environmental LDI and I think my nose dripped for 12 hours. Nothing would help. And then it went away. But people who are medically complicated are Lyme patients, right? Lyme and mold. If we flare them, and we go a lot slower with them, but if they flare, they might have brain fog, fatigue, and a headache for a week, right? That could lay them up.
Yeah.
So it's a lot more serious of a side effect.
Yeah.
But
so then we have to wait 7 weeks. So again, it's like they think LDI is working on the T cells, and so the life of a T cell lasts about 7 weeks. So we have to wait 7 weeks, kind of get that round of T cells gone in theory, and then we can redose
at a weaker dose.
Yeah.
Okay. So you said mold. That's one I hadn't thought about treating with LDI before, especially patients who, we all have them, are living in mold, can't afford or can't get out of the mold, right? Or can't identify the mold that they're living in.
I have a good example of that one. It doesn't treat mold illness. You still got to get them in a mold safe environment. You got to do binders,
but at least to get them to a point where they can get out of their lease or get the house tested or move.
But some people just have an allergy to mold.
Right.
Where they're not fully sick with mold illness, but they're
their
getting
immune
a
system is reacting.
lymphadenopathy. They're just feeling under the weather maybe a week out of the month. They just don't feel right. That's when I have a patient I'm using that with, and they're stuck in a lease in a rental.
Yeah.
And that seemed to help.
He's reacting.
Mhm.
I'm also thinking about clients. Like I have a fair amount of clients that they're fine because we've cleaned up their environment and detoxed them, but they're so sensitive and their genetics are so
Yes.
susceptible to mold illness that they go on vacation, whether it's an Airbnb on the coast or a hotel that we know are, I mean, there's mold everywhere in hotels and apartments,
Yep.
in Airbnbs. So I would think, so like, would you treat with LDI when they get back if they were exposed?
No, before they go.
Before they go.
Take it.
So cool.
Yeah.
Okay.
Yep.
And sometimes mold can also just be a trigger for other things as
Absolutely.
well. So, you know,
Yeah.
a lot of people have been exposed to Lyme and most people don't
Yeah.
react to Lyme.
Yeah.
But then if they get triggered by something like mold, then that's when they start getting
Reactivate
like
that.
joint pain and things like that. And so then that's kind of the other difficulty is that sometimes the trigger is different than the antigen that we end up needing to use.
Very
Oh,
true.
interesting. Yeah.
Sort of thing. And
What started
so,
it may not be what's currently the current trigger.
yeah, like COVID is
Right.
often a trigger for other
Underlying root cause.
Yeah.
What about reactivation of viruses? People who keep getting reactivated EBV or cytomegalovirus or
We have, I mean, do we have Epstein-Barr? There is an EBV.
Is
I don't know
there?
if we have that LDI.
I think we just have HSV for viruses because Dr.
Vincent?
Vincent, basically he hasn't really gotten a whole lot of good response from the EBV
Bummer.
LDI.
Because that could be a big one.
Yeah, but it's things like Lyme and yeast and parasites and stuff like that, like that
Yeah.
LDI tends to work well on people who tend to have that.
Okay, so for
Response.
EBV, you said Lyme, parasites, and what?
Yeast.
Works well? Yeast. Well, that makes me think that that's just probably all root causes that reactivate EBV,
Yeah,
Right.
which we kind of know,
exactly.
and trauma.
Yeah.
Okay, interesting. Cool. So that would be why those LDIs work.
There's also an interesting one. I feel very underutilized. The upper respiratory infection.
Yeah,
The
I haven't
URI
used that a lot
LDI
lately.
has cold viruses, flu,
Cool.
and including COVID,
Yeah.
cold virus, and then Coxsackie.
Hey, was anybody using this during COVID? Like had a COVID antigen?
So Dr.
They do have a
Abraham
COVID
came up
antigen.
with, I think he was the first one to do it for
So
long
cool.
COVID.
Did it work?
Yeah. For many people. You can't say across the board it works for everybody, right?
Well,
But
yeah.
for people who've
Okay.
lost their sense and taste of smell. I had a patient
Yes, I
recently
can
was
imagine that would
treating
help.
for
That's right.
long-term respiratory following a virus a couple months later. She was still feeling short of breath. And she came back to me so excited. And she's like, I can smell again.
Mm.
And I thought, I didn't know you couldn't smell. You didn't tell me that. And so, yeah, you can use it
But
for
that
things
worked.
like that.
You use the URI for that?
Yeah.
One? Okay.
Yeah.
Interesting.
It's
Yeah.
also can be used preventative before travel. So you can
Absolutely, yeah.
actually, I'll be doing that before I go back east this summer with my
Yeah.
kids.
Yeah.
We'll all do a URI LDI. The dosing's different for if you're already actively having symptoms
Okay.
versus preventative,
Okay.
but it can be pretty effective.
So cool.
Yeah.
So cool. Well, it sounds like we need to train more of you. More of us. More of us need to be trained, right? Are you guys even do you even have spots in your schedules for new clients to receive LDI therapy? That's probably one of my bigger concerns.
I know.
Like,
I'm
should
currently
we be
booked out.
introducing this? Like, I don't even
Yeah.
think you guys are taking new patients.
I'm
No,
currently
How do they
booked out
get access to you?
September.
If clients or if our community is listening to this and they're like, I know this is what I need. I at least want to try it while I'm working.
I have more open spaces on my telehealth day.
Oh, okay.
You don't need to get
You don't
it
need to come in.
person.
Yeah.
I
Mhm.
tell you how to administer it to yourself because it's not a shot.
Right.
So
Easy.
you just
Yep.
pick it up at the front desk when it's ready.
Okay. Okay.
And we are taking new patients.
Wonderful.
Yeah.
Okay. That's so good to hear. So
Yeah.
out of our Boise clinic, Karen and Amy, I know that also, I mean, we have so many practitioners from really all over the country that listen to this podcast too. So what do practitioners need to know before they refer a patient for LDI?
The sky's the limit. Well, we could
Okay.
go through some of the conditions we treat with that we haven't mentioned
Like,
yet. just
oh,
to
I want to hear it all.
I have my list.
Let's
because there's
do it.
This is
What
not,
else do we
this
treat?
is not limited to this list,
I'm
right?
sure,
So
yeah.
I can also tell them, if it's okay, to go to Dr. Vincent's website because you can plug in a disease state or a condition or a symptom, and it will tell you whether they have an LDI for that. And then you can come,
What's
see
his
us.
website?
globalimmunotherapy.com.
Okay.
Dr. Ty Vincent.
Yep.
So that's helpful too.
Absolutely.
But we already talked about food and allergies with the environment, chemical sensitive patients. There's a chemical LDI. That's great.
I had a patient who started headaches when she or migraines when she took the medication for the acne. Accutane, with the Accutane. And so I started her on the chemical LDI. And yes, she's like, I can play with my kids again for the first time in
It's
years.
pretty neat.
So it's really cool. But yeah, sorry, go ahead.
No. Fibromyalgia, Lyme, Hashimoto's, RA, interstitial cystitis, chronic pain like that. It's amazing. Acne, IBS, chronic diarrhea, alopecia, dyspepsia, endometriosis, psoriasis, dandruff, trigeminal neuralgia, HSV 1 and 2.
Yeah.
So they don't have to be on suppression meds.
Right.
Upper respiratory infections. We will be getting the varicella LDI that can help with shingles and post-herpetic neuralgia. Hands, pandas with the strep LDI, urticaria, asthma, migraines, EMF sensitivity. Chemical LDI helps with that.
Okay, I'm going to refer you someone tomorrow.
Rosacea, IBD, osteoarthritis, collagen LDI. ADHD for some people. Lichen planus, eosinophilic esophagitis. Huge.
Well, you're naming so many conditions that are hard to treat.
Right.
Not only conventionally, but from a functional medicine perspective too.
Yes.
So if you can move the needle for some of these clients, it can be really huge. Sorry, keep going.
No, you're good. Recurring, styles, boils, folliculitis, hydrodentitis suppurativa. I don't say that correctly.
Okay, HSE.
It is so painful and disfiguring for people. Yeah. And that's a huge one. Impetigo, gallbladder issues. That's a food issue.
For sure.
After you've had, POTS, anosmia, so lack of smell, wildfire reactions, the chemical LDI.
Chemical, yeah.
SIBO, some people respond to the food one. Tendinitis, plantar fasciitis, and labral tears. Again,
even styes.
Yeah. Where people get recurring styes.
Yeah.
Or that's a quick, easy treatment is to come in and do an LDI for a sty.
As opposed to putting steroids on a very already thin layer of skin.
And warm compresses aren't enough.
Which is often the case. Oh, that's just so neat. Oh, I feel like, do you guys have any other success stories to share? You've shared some really incredible ones. Anything else?
A lot. It's a lot. There's easy wins with food and environmental. I think the ones that stick out in my mind are the PMDD, these women who are depressed or suicidal the week before their period.
Yeah.
That's a big problem.
Yeah, it is.
So it works really well. The
or postpartum depression too.
I haven't tried that yet.
I haven't. I still usually focus on, that's a whole other podcast, but the zinc and copper and all those things, the minerals that get depleted and all that. But we could try that. I'd be open to that. Chronic UTIs, not just I'm not talking due to atrophy and postmenopausal women, just there are some women who are just prone to UTIs their whole life. And that could be their reaction to Proteus or Klebsiella, E. coli.
Or an anatomy issue, and they're just more likely to react to something too.
So they're
more sensitive.
Yeah, just getting people off suppression meds that they don't need to be on.
Yeah.
That's key.
Yeah. And they don't actually, as long as they have some symptoms, they don't have to get off their suppression meds right away.
Okay. So you don't aren't worried we're going to pull the rug out from underneath them. Yeah.
Exactly. And even food sensitivities, we say, all right, keep those out of your diet until about a week later and then test. So it's not feeling like you're miserable while you're waiting to kind of see.
Then you reintroduce and see how you do.
Yeah.
So neat. So anything we didn't touch on that you feel is really valid or valuable to share about LDI?
I'm trying to think. Probably just knowing that for most people, it's a little bit of a journey. It's, it's trial and error. So you got to be patient. The patient has to be really intuitive and able to interpret their response.
Ooh,
I spend a lot of time talking about, okay, this is your normal flare response, but a flare to LDI will be exponentially worse.
Yeah.
Because they'll say, well, I flared. And then we dive in and dissect that. What does that mean? Well, I had my symptoms, but that's your normal. Right. That means it was not an effective dose and we need to go stronger.
Right.
So it takes time for them to learn the data we're really looking for so we can make the educated decision on, do we need to go stronger? Do we need to repeat this and just make sure at this dose? Or was that an actual flare?
Yeah.
That's the key point. It's just they need
really good communication is definitely helpful. And sometimes it's hard to kind of pull that out of patients because they feel they're so nervous about flaring. So they think that
Any little thing is
Any
a flare.
little thing is a flare.
Or if they get sick and they're trying to,
And that's the other part that's hard because, I'll have patients who are like.
Too many variables.
Yeah. Too many variables.
Like, well, I started my period right after I took it. And so I don't really know.
Or I had a traumatic event or a stressful event.
Or I ate Thai food and I took the food LDI and I have bloating and I don't know what did what, right? So then we just repeat it in 7 weeks at the same dose.
Okay. Let those T cells burn out and just try again.
Yeah.
That makes sense.
Yeah, exactly.
Okay. So interesting. So cool. Wow. So amazing. Well, I'm thankful that you guys got trained. How incredible to be able to offer this modality for our community and for our clients.
Yeah.
Thank you for your time and your wisdom and your intention with what you're doing for all of our patients at FMI.
Absolutely.
Thanks for being with us.
We love it.
Pleasure.
Yay.
Thanks for having us.
Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit funmedshop.com today and take the next step in your health journey. That's funmedshop.com. Thank you for listening to the Functional Medicine Foundations podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.